define medicine as preservation of health and a cure of disease. Preservation of health, then a cure of disease. And that's what I think we all are here about, to try to preserve the health of the human being. So we actually treat the patients. I think this is very important. Unfortunately, many health ministries around the world, they spend most of their money, maybe 90%, 95% on treatment of disease, and maybe 5 to 10% at most on preventive measures. I think this should change and time has to come. Thank you very much.
As a practitioner of Unani medicine here in India since 2002, I want to ask how many of you know that what Unani medicine is exactly? You don't. Yes. This was the same my confusion also when I got licensed for practicing Unani medicine in UAE in 2002. So when I came here, because this Arabic system of medicine or herbal system of medicine, when it got introduced in India, so based on its origin, it was called Unani medicine. So when I started my practice after getting licensed in polyclinic here in Sharjah, so there I did not know whether practice can grow or not, or acceptance will be there or not. We are happy to see so many Unani doctors here sitting. In 2002, it was, the picture was something different. So, because the question is related to the culture. So, when my patients who are Arabic here, when they came to tell about their disease, they started with their symptoms based on Islam. They used to say, okay, my balgam is poor, I have all these things. So this was the concept, and in the culture of Arabic people. So there I understood, this is the place where the Unani can grow. Because this was in the roots of Arab, but because there were no institutions here, that's why they did not know what Unani is. So this is based on humoral concept. Okay, according to Unani concept, body comprises of 4 different humor or akhlaq, that is dam, balgam, safra, sauda. So these symptoms were there, and they were aware about the mizaj of each food, what they eat. They used to tell, they used to tell, means I got diarrhea, maybe there is harara al batan. My hemoglobin is more, maybe dam imbalance is there. So then we know that this is part of the culture. And treatments like hijama and all, which were part of Unani medicine, in 2005 when it was regulated, when the practices were growing, I got licensed in 2005. Then later on, the evidence-based treatments were done through hijama also. Then now most of the allopathic doctors also practice it, seeing the benefits of it. So I wanted to add few of my words for people to understand how you can integrate in based on the culture of the population here. Yeah, thank
you. The last question of this panel discussion, and after that we will have a coffee break, and then we come back and we have to pen down all our recommendations so that they can be collated. So each of the tables will have to pen down their maybe 5 or 6 strong recommendations, which will be then collated and presented in the evening. So that's another part of homework. I'm being a devil, I'm so sorry, but that has to be that way. So we move to the last and very pertinent question. I think this is exactly what we really need to do. And it says, looking ahead, what is the future of TCAM in global healthcare, and what steps can governments and international organizations take to promote the safe and effective integration of TCAM into mainstream healthcare systems? And looking ahead, what is the future of TCAM in global healthcare, and what steps can governments and international organizations take to promote the safe and effective integration of TCAM into mainstream healthcare systems. We had a good barrage of questions, but we had to cut it down because in the interest of the time. I need this to mention that because we belong to all different parties, there will be certain specific points that you would like to raise. So that's exactly what you can do when you put up the recommendations for going further. So that is something that you can do while you are putting up the recommendations finally. Thank you so much. Anybody who's ready with the response can come over and start from
You can.
Just in a couple of minutes or maybe not. But very humble submission, crisp and short.
I am Dr. Salman from India. I am talking in behalf of Undergraduate Medicine. So, when it comes to mode of treatment, all doctors will be saying our treatment is best, our treatment is best, our treatment is best. It can be PCN or it can be modern medicine. So, according to me, it's my opinion. I don't know whether other will be agreeing on this. I thought of there should be some short-term course or any long-term course. In that, they have to teach about all mode of treatment. That is, it should be Unani, homeopathy, herbal, Chinese medicine, anything it might be. Okay? So they should learn on that, and they should keep that special counselor on the particular hospital. It means in all hospitals, in front desk, they should sit and they should advise the patient कि you can go for this treatment, you can go for this treatment, like that. So that every physicians or every mode of treatment may get better chance globally. That's it. Thank you.
Yes, please, anybody else would like to respond?
I think 4 or 5 points the team has finalized in this direction. One is that we have to be a bit more progressive and open in terms of that information technology and the tools which are coming up, the AI tools which are coming up, with all understanding and reservations as per the law that is in place, that these things have to be looked into and their assistance and these such inventions in the United System of medicine or other systems of medicine that we have to take care of. We have also to look into the scientific validation for the products and efforts to provide the knowledge to stakeholders. Because